Hello, everyone. Good afternoon, and thank you for joining us for today's conversation on firearm research and policies to protect youth. I'm Rebecca Rosenquist, the Health Policy Director at Policy Lab. Firearms are a leading cause of death for children, but moving the needle to address gaps in research or promote policies that can help prevent child injury and death from firearms has proven difficult. As a pediatric setting, one of our top concerns is unintentional firearm-related injury in children. But like many issues surrounding firearms, there's a lack of research on which policies, programs, and approaches can best protect children. This led us at Policy Lab to team up with our partners at CHOP's Center for Violence Prevention to create an evidence-to-action brief that evaluated existing research on firearm legislation, identified gaps, and proposed evidence-based public health approaches to prevent unintentional firearm injury and death in children and teens for policymakers, health systems and providers, caregivers, and community organizations. We also created an accompanying policy brief that builds out recommendations for research. This work inspired us to put together today's event, and we're excited to be joined by a terrific panel of speakers to focus more closely on building out research to spur policy action. A couple of reminders for those listening in to today's presentation. All attendees' lines will be muted and video will be disabled throughout the event. We're looking forward to a robust discussion following our presentations. So if you'd like to submit a question, you can do so at any time during the event using the Q&A feature located on the right-hand side of the platform. My colleague, Dr. Polina Kras, who is an attending physician in the Division of Adolescent Medicine at CHOP, will join me in moderating the Q&A portion of the event. She'll also be monitoring the questions and will be turning to them after the presentation, so please do put them in there. Before we dive in, I'd like to introduce our panel of speakers. So first up, we have Dr. Ruth Abaya. Dr. Abaya is the program manager for the Injury Prevention Program at the Philadelphia Department of Public Health and is also part of CHOP's Center for Violence Prevention. Next, we have Kelly Drain. Kelly is the research director at the Giffords Law Center to Prevent Gun Violence. Also with us today is Dr. Joel Fine. Dr. Fine is the co-director of the Center for Violence Prevention at CHOP. And lastly, we have Pennsylvania State Representative Todd Stevens, who represents parts of Montgomery County in Harrisburg. So welcome, everyone, and thank you for being with us today. For more details on the bios of this great group of experts, please check out the Policy Lab website. To get us started, I'm going to hand it over to Dr. Fine to do a bit of level setting for us. So Dr. Fine, based on what you've seen in research and practice over the past several years, can you talk about the role of pediatric settings and providers play in preventing firearm injury and how policy changes might make a difference in initiatives like promoting safe firearm storage?
Sure, and thank you, Rebecca. So as you mentioned, over the past few decades, the healthcare world has really increasingly recognized the physical and emotional toll of gun violence, and that includes unintentional shootings and suicide. And it's odd but tragic that over the past 3 decades, firearms have led to tens of thousands of deaths annually in the United States, and many of them are suicides and unintentional injury. And so it's the one cause of death that has not shown a substantial decrease over that time period. And it's clearly one of the reasons that we established the Center for Violence Prevention at CHOP. But as a result, the pediatric community and the family medicine and other physicians have really taken a lead in trying to incorporate gun safety into our kind of routine care, assessing the risk of firearms in clinical settings, and when appropriate, entering it into every clinical setting that in which we encounter children. And because we can do this in a non-judgmental, collaborative manner with the support of patients and families, we know that it actually has a very positive impact. If you look at the ASK program, for example, which is Asking Saves Kids, which is targeted exactly at making sure that clinicians can ask about guns and guns in the home and access, 96% of parents who were exposed to that program it was a positive thing that they were asked about it, and that even gun owners who what people would have thought may have been in some way taken aback by it were really appreciative of the conversation, because it's done in a way, and it's taught to be done in a way that is respectful. What we also know is that if the collaborative approach is taken, it helps families store guns more safely. So a study, I think it was in 2005, found that making guns and ammunition inaccessible was associated, or could be associated, with a 78% reduction in suicide deaths and an 85% reduction in unintentional shooting deaths in kids. That's dramatic. And again, this is the reason that we're promoting, and as a pediatric institution, we're promoting these practices. I'd like to offer my colleagues other ways of talking about this throughout the event, so I won't spend a ton of time, but it really is in our wheelhouse, and it is our lane, and we're going to be staying in it and driving fast.
Thank you for that, Dr. Fine. So next, we're going to hear from Representative Stevens. So, Rep. Stevens, we know that there can be strong evidence in favor of a policy, but actually getting movement on that policy can be very difficult. So how do policymakers, such as yourself, take data and evidence into consideration during your decision-making process? And what do you see, or what have you seen as some of the best practices in terms of translating evidence to policy on the specific topic we're talking about today of preventing accidental injury from guns for children and youth? Rep. Stevens?
Sure. Thanks so much. Thanks for the question, and thanks for the opportunity to be here. This is a subject that the overall subject of gun violence is something that's been very important to me for quite some time. Prior to joining the House of Representatives, I was a prosecutor in Montgomery County, and also with the U.S. Department of Justice, and I was a firearms prosecutor over that period of time. And so when I went to the House of Representatives, naturally I dug in on criminal justice issues and gun violence issues in particular, which is unsurprising given my background. It wasn't until, and so let me just expand on that a little bit. My focus was largely on homicides, what I'll call street level homicides that we hear about every night on the news. Sadly, Philadelphia is under siege right now from firearms violence, those types of firearms violence issues, the homicide issues. And it wasn't until Parkland, Florida occurred that I started to dig in on some of the other issues concerning people in crisis and other areas where gun violence affects people and unfortunately is taking lives, but maybe not through a homicide. It may be through suicide or accidental discharge. And I was shocked to learn that nearly 2/3 of all gun deaths are in fact suicides, both in Pennsylvania and nationally. That's true. It's north of 60%, as high as 67% across the country. So I really began digging in on these issues. One of the things that is great about being a state representative is I get to go to Harrisburg and I get to work with colleagues from all over Pennsylvania. And not only do you sit around and talk about, the bill that's pending that you're about to vote on or the amendment or something like that, but you just talk about life. And we are really blessed in Pennsylvania with a rich and diverse state, but we're diverse in a lot of different ways. When you think of diversity, a lot of times you think of racial diversity or ethnic diversity. Pennsylvania is rich with geographic diversity. We have, the wide open plains, if you will, of Lancaster County, the breadbasket of Pennsylvania, but then we've got the Allegheny Forest in the northwestern part of the state. We've got the Appalachian Mountains traversing the state. We're economically diverse and we're culturally diverse. And this is where guns come into play. In southeastern Pennsylvania, we just have a very different perspective by and large about firearms. We don't generally see as much of the utility in firearms. Folks who are firearms owners very often are into, maybe into hunting, maybe into target practice or carry for self-defense. Outside southeastern Pennsylvania, though, the culture is very rich in firearms history. The ownership rate is much higher, particularly in Western Pennsylvania. In Western Pennsylvania, we have some of the counties with the highest incidence of gun ownership rates in the country. So it's just a very different culture. Out there in other parts of Pennsylvania, it's rare for you to not have a firearm. or multiple firearms. And many of my colleagues from across the state look at guns in a very different way than we do. So how do we cut across that? And Joel made, I think, a great point, which has been coming into greater light over the last several years, and that's by adopting this public health approach, by taking a look at these issues from a public health perspective and relying on data, relying on evidence to explain to folks what the issues are. The Policy Lab has done a great job at rounding up some data on a number of different subjects, but in this one, just providing for us that, unintentional firearm injury was the most common type of non-fatal firearm injury among children aged 0 to 14 in both rural and urban areas. 1 in 4 deaths from unintentional injury were from children. Overall, there were higher rates of unintentional injury in rural than urban areas. So often we think of guns as a problem in our urban areas, Philadelphia, Reading, Harrisburg, the city of Lancaster, Pittsburgh, Erie, our third-class cities. We often think of it as an urban issue, but the reality is, as the data shows, it's just as much, if not a greater problem in rural Pennsylvania. A lot of that stems from the fact that gun ownership is so much higher in rural Pennsylvania. But I think what's really important is when we talk about it from a public health perspective, when we talk about it from a data perspective, when we use evidence-based approaches, I think we can transcend some of those cultural issues that I spoke about earlier and really, raise this issue in a positive way where people will stop and think about it and really dig in on the issue. So I think that's how we can move forward in adopting good policies, by taking a public health approach and relying on evidence-based practice. Thanks for having me.
Thank you. Well, thanks for being with us, Rep. Stevens. It's really helpful. And we're so glad to have that perspective, your perspective, and the perspective of a policymaker in the conversation. So now we're going to turn to Kelly Drain to get her thoughts on this topic. So Kelly, we know Giffords Law Center has done so much work to move the needle on gun safety legislation. From your perspective, how can research be used to advance child firearm safety policy, and how can leaders overcome challenges to get results?
Yeah, thank you so much for having me and inviting me to join this important conversation. I think one of the ways that we use research at Giffords is that we are really involved in working with policymakers to draft legislation. We provide edits to bills and help policymakers draft sort of the best versions of policies. So, Dr. Fine mentioned the importance of safe storage and laws that require the safe storage of firearms and impose liability. Those laws are often called child access prevention laws. And I think what research on these laws has done is it's sort of told us what the essential components of these policies are. Many states have these laws, but they look very different in different states. So just as one example, in Wisconsin, these laws pertain to children under the age of 14, and the penalty is a misdemeanor for leaving a firearm accessible to children. In California, the law applies to children under the age of 18, and the penalty can be a felony in certain cases. And so there are a lot of differences in how these laws are crafted and how they will be enacted in practice as a result. And I think it's really important, and we need research to tell us what is essential to making these policies work, and what are the important components that we need to include in these bills as they're being passed. And so, for example, related to cap laws, we know that states, researchers have found that states that allow felony prosecutions of offenders have seen the largest reductions in firearm deaths among youth. And again, we use that to craft the kind of policy work we do. The second part of your question about sort of how we get progress, I think I would just say that research is really important, can be really important in giving some coverage to policymakers who choose to vote for gun safety laws. One of the things that we see is that often to overcome challenges and pass laws, policymakers have to have courage, sometimes a little, sometimes quite a bit, and make choices that go, in the opposite direction of what some of their constituents think, or are, different than what the rest of their political party thinks. And I think research can be an important tool in helping lawmakers justify their position and their support of a controversial bill, that they can point to something to say that this policy that they've worked on or voted in favor of does have evidence to support it. And the last thing that I'll just say is that I think the diffusion of science into policy is often incremental. And we know that, right now, I think a lot of our progress is based on these sort of large catalyzing events that pique policymakers' interest and appetite for scientific evidence and policy change. But we know that we're also seeing really important steps being taken, across the country. So I just want to commend that, this year Colorado passed a safe storage law to encourage, the storage of firearms, encourage safe storage of firearms when children are present. And that, that law was passed in addition to other measures that will help prevent child deaths and injuries. And we've also seen that Oregon has been working for 4 years to pass a safe storage bill that is now headed to the governor's desk. So I think there is a lot of progress, and I think research is a really important part of promoting this progress.
Great, thanks, Kelly. So much richness to dive into here. I know we'll pull out some of these common threads when Paulina gets the question and answer period of this session, but now I want to turn to Dr. Avaya. So turning to you now, we know you have such a unique perspective on this issue as both a provider and as the leader of an injury prevention program for the city of Philadelphia. So can you talk a bit about how community leaders can shape research and policy, and how trusted messengers can help share information, protect children from the dangers of firearms?
Sure. So thank you so much for having me. It's really great to be part of this panel and great to hear what my fellow panelists have had to say on this topic. I did want to spend a moment just kind of giving a little bit of context, and it's all things that I think many of the people listening in are aware of. 2020 was definitely a record year for the city of Philadelphia. In the last few decades, over 50% were shooting victims in the prior year. And Philadelphia was not alone in regards to having a standout year when it comes to violence. Just by the early part of this month, we had over 700 shooting victims, and we just passed over 200 lives lost due to homicide, the vast majority of which are firearm homicides. And what we saw in 2020 is that while children make up a fairly consistent percentage of the total people injured and killed, we're seeing increasing numbers. As we see increasing numbers in the general population, we're seeing increasing numbers in children as well. And I do want to name the profound disparities that we see in firearm deaths, specifically in cities like Philadelphia, but really around the country, and the trends and what that means as far as a public health approach and thinking about downstream effects. So as far as community leaders participating in solutions, specifically policy solutions, I think one of the first things I wanted to highlight was the importance of knowledge and inclusion of the community, and thinking about who the right leaders are. I really appreciate what Representative Stevens said about the diversity of Pennsylvania and the importance of recognizing who the relevant stakeholders are based on location. As we try to do some statewide engagement from our team around certain issues like permit to purchase, what we found is, our messenger should and needs to change depending on who it is that we're speaking to. The one thing that's beautifully universal, I think, about communities that we all serve is that children are a priority in all of them. And drawing on that common thread and that critical importance allows us to think about who are the relevant stakeholders and how do we engage them as carefully and inclusively as possible. So I think that that's the first thing, knowledge and inclusion of the community. And then the other thing I wanted to highlight as far as community leaders really shaping research, shaping policy, is the importance of using data to recognize trends, including surprising ones. One of the nice things about data is if you're doing it properly, it just tells you what's going on. And sometimes what's going on is not what you think or what you suppose. And it's not necessarily driven by the things that you would assume. And so following the data where it leads, including to surprising conclusions, allows you to really use data to inform innovative, both research and policy. And data should inform both. So we're used to the concept of data informing research and research informing data. We're used to that relationship, I think, a little bit more. When we think about data informing policy, there's so many other things that influence policy. I think sometimes it's a little bit harder for us, and certainly for people who are outside of our wheelhouse, to think about that connection. So when we say that data should inform policy, it means that we should really be thinking about where the greatest burden of disease is from the data before we kind of craft policies that we think are actually going to make a difference. And that's why I think the policy brief was so important in kind of highlighting what that really means. Finally, when community leaders really think about shaping research and policy and their responsibility to do so as community leaders, the wide lens and the public health perspective is incredibly important. I think there's been a great deal of lip service given to using a public health approach to address violence for a long time. And what's been, I think, really really refreshing in recent years is that there's been a lot of more concrete conversation about how to operationalize that. What does it mean to take a public health approach to this as you might to COVID, or as we did to motor vehicle collisions and other critical public health problems that affected children? And so there are a couple of elements to that. One is thinking about population health, not focusing on individual punitive approaches to addressing violence, but rather how do we really address the population that's affected? The other is a real kind of concentration on the upstream drivers. What are the things that ultimately are going to address, what are the policies that are going to address those drivers that kind of precede violence actually happening? And then how do we empower, and this is so relevant to things like cap laws, how do we empower those closest to a problem to inform solutions that are actually sustainable and that people will continue to employ over time? And so I think that if those perspectives are held close, it's much more likely that the policies that are shaped, that are developed, are going to be welcomed by community, are going to be identified as potentially useful solutions, and are going to be sustainable. And I think if we're all relying on the data, then we're all operating from the same kind of foundational place, which allows us to be consistent, to be creative, and to ultimately start to see some changes.
Great, thank you so much, Dr. Abaya. So, that was a really rich set of introductory remarks from our whole panel. I think it gives people a sense of, where the expertise lies in this panel. So we want to thank all our panelists again for walking us through, the important questions and considerations we put forward there. And I think now is when we can turn to some real, the question answer period to dig into some of what you said. I'm seeing questions come through the chat. I know that Dr. Polina-Cross is watching them, and we'll be figuring out where to put them, but please keep those coming. So now let's move into this. Put your questions in the chat, and I'm going to hand over to my colleague, Dr. Cross.
Thank you so much, Rebecca, and thank you so much to our panelists for being here and our audience for your participation. I'm going to kick it off with a question that I'll direct to Kelly, but is open to anyone. The Representative Stevens talked about how views on guns can be vastly different, even in the same state, such as Pennsylvania. How can decision makers or folks who work closely with families like pediatricians better partner with and also align themselves with gun owners in working to prevent child injury and death?
Yeah, I think that's such an important question. We have research that was published before the pandemic that said that there were 4.6 million American children that live in homes with unsecured firearms. And we know that during the pandemic, we had lots of new purchasers buy guns. So I think it's really important to think about, that if safe storage is really one of the policies that we know can prevent unintentional child gun death, I think it's really important that we think about how can we engage these people that are not that aren't safely storing their firearms yet, or provide messages about the importance of that to these new gun owners. I think there are really interesting interventions that engage gun owners. So there are public health departments that are working with gun stores. There are other programs that work with gun groups to really sort of make sure that these gun owners understand the importance of safe storage and just responsible firearm ownership in general. And I think those are really effective. And I would say that for people that want to integrate sort of partnering with gun owners or working more with gun owners into their own work, I think the first step I really think is sort of learning yourself about firearms, because you have to become a trusted messenger to this community. And I think, having some knowledge about different kinds of firearms, about different kinds of firearm safety devices is really important before you start having a conversation with someone about changing their behavior. So I would say that's a first step that's really important. And the other thing is, I think, sort of building on the gun shop projects and these ideas of working with gun owners is, I think, sort of talking with gun owners about becoming models within their community is also really important. We know that gun owners really respond to messages from gun owners more than many other kinds of messengers. So thinking about kind of talking with gun owners about how they are models within their community, I think is also a really important step.
If I could just, can I follow up on that for a second?
Please, yeah.
Dr. Abaya made a good point during her presentation, and Kelly just highlighted it there as well. I think it's important for the folks who are having those conversations and trying to deliver that message, to be part of that community, part of that culture. It's hard for me. I'm from the Southeast, and I show up in Western Pennsylvania at a sportsman's club, and I want to start talking about extreme risk protection orders or safe storage issues and everything. And if I'm dressed like this, I'm in my suit, and it's lost on folks. If you connect with them, you really need to have folks within that community be the messengers. I tell advocacy groups all the time, I as a state representative, I hear from folks all over Pennsylvania, but the people that really matter to me are the ones that I represent, the ones in my community, the ones that I see at the grocery store, the one that I see at the soccer field, the Little League field. That's where I think you can really make an impact. If folks in those other parts of the state can start speaking about these issues and voicing their concerns about these issues, and I think that we can really start to move the needle on some of these policies. The other thing that's a little bit of a challenge, and I referenced it a little bit in my remarks, every day we are bombarded here in the Southeast with another shooting in Philadelphia. How many, what's the shooting rate right now? What's the death rate from shootings right now? I have a Twitter feed that I subscribe to every morning. I wake up and, see how many shootings happened overnight, which is a really sad state of affairs. But, the media drives a lot of the conversation. Just this week, sadly, out in the Tribune, Trib Live, which is out in Western Pennsylvania, had a story about an accidental shooting in Monroeville where a 5-year-old accidentally shot and killed his 3-year-old sister. And, it's heartbreaking when you think about that. But that type of media coverage, I think, may get people to start thinking about it. In that article, they noted that there were 5 firearms in the house and none of them were stored safely. In this instance, the 5-year-old climbed up on a chair and pulled the gun off the top of the refrigerator and ended up killing his sister. So the more that we talk about it and the more that it's coming organically from the community to other members in that same community, I think the better off we'll all be at moving the policy on these issues.
Ruth, I know that you spoke in your remarks about centering the community voice as we have these conversations, and I was wondering if you had anything else to add in terms of how we can kind of do all the things that Representative Stevens was mentioning in terms of making sure that we're meeting the community where they are.
Yeah, so it's a great question. I think the first thing is identifying who the community engages with regularly and who are the community members that are trusted. And I think that we should never make assumptions about that. So I think there's one particular kind of concrete way that a lot of organizations do this, which is establishing things like community advisory boards. And that involves bringing people into research, into policymaking, into programmatic areas that are members of the community and can comment on why something may or may not be well received there. And the responses are often surprising. There are some things that we think would be not well received or that would not be acceptable. And we have common perceptions that no one's going to lock their guns in inner city Philadelphia. And you find out that there are community groups that have been teaching about safe storage, providing devices, and getting people to successfully lock guns for decades. Their message is different than ours, and we need to engage them to know how to better do that. So I think there needs to be, honestly, just a lot of humility in recognizing what we know and what we don't know about different communities. And I think the other piece of kind of genuine community engagement is not taking the community voice for granted. So giving people a real seat at the table. Sometimes that involves giving them a paid or positioned role in the work that we do, and recognizing that not just the credentialed individuals who come to the table and speak on an issue, but the people who have lived experience. We should value that equally and make sure that when we sit around a table and talk about solutions for a community, that there are members of that community at that table.
That's great. Thank you so much. I'm actually going to turn next to a question from Nicole in the audience. So thank you, Nicole. She said, safe storage laws that only apply to households with children do not take into account the myriad of homes children may visit without safe storage mandates. How can we address this in the legislature? And I'll broaden and say, how can we address this as trusted community messengers in the healthcare setting? And maybe I'll actually turn it over to Joel to address the latter, and then we'll touch on policies as well.
Which one was the latter?
Oh, sorry, I mean the former. My bad.
Okay, good. Thanks for the question, Nicole. I think that it's not necessarily the home that we are discussing, but it's actually the child's access to a weapon. And there's a slight difference between laws where some laws are aimed at if the child has any access to a weapon, there is a penalty, and those are called negligence laws, right? And then there's what we call recklessness laws, where the child has had to actually injure someone with a weapon that was accessible to that child in order for a penalty or criminal liability to be imposed. So it's in any home that this can occur, right? It's not in just that child's home where they reside. What we know from some strong evidence is that the recklessness laws, where someone has to actually be injured, are kind of like the too little too late laws, and that if you have a policy where people know that they need to keep a gun out of the child's reach, out of the child's capability of reaching and getting and accessing, then those laws are the ones that actually reduce the firearm death that we're hoping to, and firearm injury that we're hoping to reduce. So and more research is needed in this area, but I think that we have a fairly good grip on the difference between those two laws.
That's really helpful, and it speaks to some of what Kelly was saying about trying to study these small differences between different policy implementation. I'm wondering if either Kelly or Representative Stevens, you had any other thoughts about how we can, broaden our conception of safe storage policies to include other locations where youth might be.
Yeah, so I'll jump in there. It raises some great points, right? Because kids may visit their grandparents, or they may visit their their uncles or aunts, where there are not other children. You see that my kids are young. I have a 9-year-old and a 6-year-old, and I just remember, when you're a first-time parent and you're like, putting pads all over the corners of every coffee table, and you're like petrified that they're gonna, injure themselves, and then you go, I go to my parents' house with my kids, and you feel like there's glass everywhere, a fireplace poker, who knows, whatever, because they haven't child-proofed their home. It's kind of the same concept. And parents really need to be aware, I think, of, where their children are visiting, and ensure that they have just a frank conversation. Look, if there are firearms in this home, I hope that they're, securely stored. Are they? That kind of a thing. And I think an awareness about that is really important. It's easy to think about, as I said, the corner of the coffee table or the fireplace or the electrical outlet, because you see them. But you really need to take that affirmative step and ask and make sure that that wherever your children are visiting, those folks, if they have firearms, have taken the steps to ensure that the children are safe.
And Representative Stevens, thank you for bringing that up. I also feel that one of the things that Ruth and I are both emergency physicians at CHOP, and one of the situations that we see, unfortunately, all too often is a gun that's actually brought into the home where the child is living. And so when we ask the question about gun access, we ask something to the effect of, is there ever a gun in the home at any point during the week? Right, and so that it's not saying, do you own a gun, or are you keeping a gun in your house? But what is the child's actual access to guns at any point? Because people do come in and out. A brother or an uncle can be a police officer, or someone who has a weapon that they tend to carry around, and they put it on top of the refrigerator. We've seen that story, actually, that you mentioned a number of times. The top of the refrigerator seems to be I don't want to tell any kids this, but that's the place to find things, apparently.
Thank you both. That's really helpful. I think I'd like to move a little bit towards this idea of pragmatically implementing. And I'm going to ask another question from the audience. And the question goes, if guns are used for protection, a conversation about gun locks is going to be a non-starter. how do we provide people with safe storage alternatives that are viable in these circumstances and move beyond this blockade? And I'll open it up to the group and wondering if anyone has any thoughts.
I think it's a great question. There has been a lot of conversation about kind of harm reduction and how do you engage with people about their motives for gun ownership in the first place and how that might influence their willingness to engage with safe storage. And there are people who will discuss these things very transparently with families and say, listen, if you feel like you really need the access to the gun at night when things get squirrely, then maybe that's when you have it in your bedside drawer, but not during the day when the kids are awake. We obviously advocate for best practice. Best practice is to make sure that guns are safely stored in the house at all times. And, you know, the standard kind of AAP tagline is that ultimately the safest home is a home without a gun. So we want to stick with our convictions, but we also want to recognize that if we are turning someone off to any safe storage, we want to do everything we can to mitigate harm. And I do think that that's a conversation that needs to be engaged more, especially by people who are giving this advice in places like primary care settings and in emergency departments. It's similar to the harm reduction conversations people have with many other public health crises like drug addiction, et cetera. How do we mitigate harm? What's our form of, for example, naloxone when it comes to gun violence in children? It's complicated, but I do think that it's a worthy conversation.
Parenthetically, hopefully soon the American Academy of Pediatrics will be coming out with some videos on how to do this counseling in exactly those situations. And it's really meeting people where they are and working, again, collaboratively with them to move them to the next step of safety, and then maybe the next step after that. And so I think that it is a conversation. It is not a dogmatic rule that we think about when we're talking about guns for people who legitimately, for whatever reason, believe that they need access to it for part of the day, if not some.
And I think
That's really.
Oh, sorry.
Go ahead, Kelly.
I think Dr. F.I. had made this point, but I just think it's important to remember there are so many different ways to safely store a firearm, and like there are different kinds of gun locks. And again, I just think like having a conversation about what are all of the different options that are available to families to use. Like I think there are many different ways that families can choose to safely store their firearms. And I just, you know, again, I think that it does come down sometimes. I think that when we say safe storage, I think we all have our own individual definition of what that might mean. And I just think it's really important for people that are counseling on safe storage to really understand all of those different options and be able to present them fully to people to choose the best option for them.
Yeah, that's really helpful, and love the idea of a naloxone for firearm safety. I guess the question I have next is one that comes from Tanya, which is how do we reach the parents who don't routinely bring their children to a primary care provider? Are there any school programs or other community programs in existence that can help bridge that gap?
So I can say a word about that. I definitely think that there need to be as many stakeholders as possible at the table. There are indeed people who engage in schools. There are people who go into the community. Our faith-based communities are major drivers of this conversation in Philadelphia in particular, and I think that that's true in other parts of the state as well. So yes, I think there are people who are engaging in this conversation. I think it's really important and just interesting to think about how differently people think about those different messengers and why they might trust one over another. And so one of the most important things I think in my work is making sure that all those people are talking to each other. And so are the people who lead the public health conversation, primary care providers, are they in touch with the faith-based leaders and the community leaders in their community so that they are all giving the same message in different ways? And also recognizing what the barriers are to that message that others may be hearing that they're not. So I think there could definitely be more work in places where children are seen. One of the things that I feel like I'm always kind of beating the drum on in Philadelphia is how do we loop in primary care? How do we loop in their pediatrician? Their pediatrician sees them every single year, and in the first year of life, even more than that. How do we loop in the people that see them all the time, that know them, when we're kind of thinking about ways to implement? And I think that there's room to grow in Philly and elsewhere.
Thanks, Ruth. And I think, again, the COVID-19 pandemic provides a really interesting example of healthcare providers partnering with community groups on issues such as this. I'm going to ask a question to Representative Stevens next that also comes from the audience. So the question is, how do you enforce safe storage laws without violating people's right to privacy? And I'm curious, firstly, if this is something you've heard from your colleagues on either side of the bench as they kind of conceptualize safe storage laws, and then you personally, as someone who's previously been in a prosecutor role, how you think about this.
Sure. Yeah, it's tough because, obviously we have the right to privacy. The Fourth Amendment protects all of us. And so, law enforcement has to stay well within those rights. And you hope that you don't learn about this lack of storage through a tragedy, as was the example that I cited earlier, where once police were there after a child had shot another child, they realized, oh, there were five guns that were not stored properly. So, it really is a matter of, someone's going to have to see it. I mean, somebody's going to have to be in that home, there lawfully. And it may be a police officer, but it may be, somebody else that raises that concern, which does, it makes it troubling. But, I think Dr. Fine, talked about some of the data that's out there. I know Kelly mentioned it too, that these safe storage laws do work. And so, a lot of what we do, there are laws on the books that we hope we never have to enforce. And, it's really about informing people. Dr. Fine was talking a little bit about the difference between recklessly endangering another person. So we have a crime in Pennsylvania, recklessly endangering another person. It's interesting because, what is that? That's the name of the crime. It doesn't tell you specifically what you can and cannot do. It just says you can't recklessly endanger another person. Endangering the welfare of children isn't, well, it's not very specific. So then there are times where we as a legislature, we will adopt a specific crime that, there's a lot of times a criticism that comes that says, well, that could have already been charged under endangering the welfare of a child. And we say, well, yes, it could have been, but we wanted to highlight how important this particular action is. And we wanted to deter people from engaging in that type of conduct. So we named a new crime that, even though it may have been punishable the same way the other crime was, it's very specific for this conduct. And so that's why these safe storage laws are so important, because it really highlights the issue for folks. And, now it's not this nebulous, well, did I recklessly endanger my child by leaving a loaded handgun on the kitchen table? It's, wait, there's a crime of not safely storing my firearm that I need to make sure that I'm following. So a lot of this is about bringing a greater awareness to the issue and really highlighting it for the average citizen. And again, these are laws that we hope we never have to enforce. The goal is to have people understand the importance through the fact that it's now a criminal statute.
Yeah, I think that's great. And I was wondering if I could just add something to that. I do think that one of the things that people who are gun violence prevention advocates have realized in recent years is that we hadn't been winning the values conversation. And I think that one of the things that really helps address concerns about affronts to personal freedoms and or personal decision making is a recognition of common values. And I actually think that it was some folks at Giffords who kind of first brought that up. We need to really start to engage with people about our common values. And sometimes there are parallels that you can draw that are helpful. So other ways that we ask people to control the way that they operate in the world, things we ask them to get licenses for, things we ask them to protect, things we ask them not to do, even in their community, like, don't dig without calling this number. And those are for common safety, and people understand that. And so if we start from the place of a common value, which sounds very squishy and soft, I think at times, but it's actually critically important. And I think people who are on the other side of this issue have done that sometimes more effectively than we have. I think it's a much safer place to start to then have a conversation about why I should be telling you about what you do with your gun in your home. It's not because I want to infringe on your personal freedoms. It's because I really never want to see your child in my trauma bay. And I think that that's a much easier, just an easier place to start the conversation.
That's great. And I think it's, again, super helpful in thinking about this continuum between research, dissemination, and then culture change. I'm going to ask a question that pivots a little bit away from safe storage, also from the audience. So the question is, what is the end goal? Question mark. More formal education for the public? And if so, where should that venue be? In schools, at place of work, at a local firearms training facility? And I'm going to ask you, Joel, maybe to start by commenting specifically on the role of education for adults versus the role of education for children and youth.
Yeah, thanks, Paulina. And before I forget, I want to mention that Paulina, with Rebecca, Meredith Matonin, and others, actually wrote the evidence to action brief that we are basing a lot of this on, and is an expert in her own right, and probably could answer many questions if she wasn't happy. That said, there's really no effective research on safe storage education for adults on a state level policy or a federal level policy. We do know that you can actually affect safe storage with adult education on it if in particular you give out a safe storage device with that education. And so there is a incremental and a significant incremental increase in safe storage at home if you actually hand someone a safe storage device in whatever setting it may be, community settings or pediatric medical settings. And so that's actually fairly well studied, and I think there's even randomized trials that support that education. And who they want to hear it from is also, I think, a really good point. A number of our panelists have mentioned the credible messenger, right? You know, we think pediatricians and family doctors and others are credible messengers because all we care about is their child's health. That's what we care about. We also care about their privacy and their rights and everything else that goes along with it, but their prioritization may be different depending on the messenger they're hearing it. Then there's education for children on safe gun storage or safe gun handling. And there's a little bit of a controversy around this because it really doesn't work that well. We try and teach kids how to, what to do when they find a gun, and they can recite to us what they heard. But in a real sentinel study, I believe it was in Atlanta many years ago, looked at 8 to 12-year-old kids and boys in particular, who were in a room with guns, and they were hidden in drawers and cabinets. And even though 90% of these kids had received some gun safety education, 75% of them handled the gun, and half of them actually pulled the trigger. Now, of course, these guns weren't loaded and probably couldn't get that study past an IRB today. But it was really an important sentinel look at, the fact that even if we get kids to learn and recite what they would do, they have a hard time integrating it into real life scenarios. And that's kind of a developmental milestone that many kids don't have at certain ages. So we try to focus on the adults getting the information, the research-based information that we know will work. Again, and all of that education that we can provide can eventually prevent injuries.
I would also just say about sort of like where the setting is. I think it's really important too when we think about, I think we're looking for sort of broad culture change. And so when we think about other public health interventions that we have had a lot of culture change around, we've reduced drunk driving, we have seen decreases in smoking. I think we also learned that we had so many messengers in so many different places, and that it became sort of a part of, another example would be seatbelts. We have so many different people that are encouraging us to wear our seatbelts that I think now, for many people, it has just become second nature. So I think the same with kind of gun safety, that if you're hearing this when you when you're taking your child to a pediatrician, if you're getting messages, if you're hearing something from your school, I think the reinforcement of that is also really essential. And so I don't think it's one and done. This needs to become part of the way that we talk about guns in America.
I really like that. I appreciate that, Kelly. And I also wanted to comment on COVID as a really timely example of ways in which we've dramatically changed our personal behavior in a short period of time to respond to a public health crisis. And that's exactly what we are kind of trying to implement here. And obviously that has not been without kind of politicization and some fraught conversations, but for the most part, most of us feel a little bit weird now when we walk out without a mask, CDC guidelines notwithstanding. And I think that's because we've been, over the last year, really, as you're saying, Kelly, inundated with messages from multiple sources about how my mask protects you and your mask protects me and our mask protects our, our families. And about both the dangers of the thing we're trying to prevent and the benefits of certain health behaviors. So I think that as we look for silver linings in COVID, one of them is the rapid change in public behavior in response to a public health crisis, and how there's this need for kind of collective action. And we've demonstrated that it can be effective when we practice it.
Thank you, and again, thank you for reframing it as thinking about public health. You used the word before and I'm forgetting it, but you did a great job of kind of explaining how we can treat this as a public health intervention. I'm going to turn it over to Rep. Stevens with a question kind of loosely taken from the audience. So the question was framed as, given the amount of gun violence in Philadelphia and specifically in public spaces, how can we balance policing and making sure we have appropriate consequences with the unintended consequences, like over policing or other unintended consequences we can't really predict? Is that, how do you think about that in relation to your leadership and your efforts on gun safety?
Yeah, look, probably not surprising given my background as a prosecutor. I do think that accountability is really important, and right now there's a general perception that people are not being held accountable for illegally carrying guns in Philadelphia and using them. We've now seen, the U.S. Attorney's Office step in to take a greater role in prosecuting cases in Philadelphia. And so, that's part of the equation. The other part of the equation, which you pointed out, is, we have to work with our law enforcement officers. And so, this kind of goes back a little bit to the conversation earlier about, who are trusted members in the community who can, deliver a message. It's the same thing. Our police officers are out there every day on the streets trying to do, the best that they can to try to deal with this pandemic, to deal with this gun violence issue. And, it's challenging for them. And so we need to figure out a way to sort of build that bridge between the community and law enforcement, and ensure that we're holding people accountable as well on the back end. And so there's a lot of legs to this stool. I mean, there's a lot of different components that all need to work together in order to get this system working properly. And when you have distrust in the community, that doesn't help. When you have folks feeling like the criminal justice system isn't delivering justice, for victims of crimes, that doesn't help. I mean, there's a lot of facets to this, but we've got to get it right because it's, I think, really having a severe impact, particularly in the city. And the consequences are dire. I mean, every day people are dying, and the number of shootings across the city every night is astounding. And the number of kids that are being shot, I mean, a lot of these are children. I mean, you hear about kids on playgrounds, they're playing basketball and all of a sudden, they're dead. It's terrible. And we're sitting in a car, with their brother or their father. So I think those are some of the issues that are at play. And I really think that this is a matter of getting the leaders in the community together, the law enforcement leaders, the community leaders, the religious leaders, and getting everyone around the table and saying, look, we've got to work together, and we have to build that trust between law enforcement and the community, between the criminal justice system and law enforcement and the community. It's all hands on deck and everyone working together. I think it's the best way to move through that.
I mean, could I add to that? I think that's really important. I appreciate you highlighting how many of these young people are children. I think sometimes we make the mistake of not thinking that a 17-year-old is a child when we see some of the statistics. And so we have to remember, like, a lot of the people who are being on either side of the gun in Philadelphia, they're children. Even when they're in older adolescents, they're children, and we need to kind of think of them that way. And I don't know that we always do. I agree that there needs to kind of mandate what is appropriate for public spaces. I also think we need to redefine what public spaces are for. So that goes back to the values conversation. Public spaces exist for community thriving. Their intent is not to be a place where an altercation gets kind of sorted out. And if we can redefine what public spaces are for and create public spaces that are designed to perpetuate health, I think we can get a little bit more creative about asking people to partner with us in what is and is not permissible. If we were in person, I would ask people to raise their hands if they could remember when you were allowed to smoke in restaurants. I don't know if anyone has, if there are people who are young enough to not remember that on this call. Right. And so there are things that we ask people to not do for the public good. And now we can't even imagine people doing those things. And it's really about that culture change and that values conversation. And those have been some big public health wins. And so I do think that there needs to be a conversation about what are public spaces for, what are parks for, what are rec centers for, which is the site of a lot of shootings in Philadelphia of recent, and how do we generate both by infrastructure and physical space changes, but also by culture, a way in which those are places where guns are just kind of not acceptable. And then there do have to be consequences for breaking those norms.
Thank you, Ruth. That's really important to think about. The kind of environmental aspects of violence, I think, is a really important point to make. And we know that it's not just individuals, but it's the entire community and neighborhoods in violence being propagated. I also want to address one other aspect that Representative Stevens kind of touched on, which is, and one of our participants actually put a question in the chat about this, and that's Rob Reed, who works with the Attorney General's office, who's looking to kind of trauma-inform the criminal justice system, right? And part of trauma-informed care is actually addressing your own secondary trauma and potential for secondary trauma. So the danger that an officer and may be in is part of that equation, and thinking about how we can bring a different lens. And it's a bit of I'm going to agree that with anyone who puts another comment in saying trauma-informed is an overused term in many ways, but it is trauma-sensitive, trauma-informed, trauma-aware, whatever we want to say. We need to kind of understand that our criminal justice system, and including policing, can benefit from that. And there are really good people in our city of Philadelphia in particular who are working in that way to make that happen. So it's not an easily solvable issue, but it is something that we can work incrementally towards.
Thank you so much to you both. I'm looking through the chat, and I think there are a lot of different models or interventions that people have mentioned that they think might work. And I'm wondering if this group wanted to take an opportunity to raise any models or interventions that are evidence-based that haven't yet been mentioned during this conversation.
So Paulina, do you mean policies in particular?
Yeah, I mean, so they're kind of both, and I think it was confusing the way I put it. But for example, like at the community level, Joel spoke about Ask and kind of the Ask campaign, and I'm wondering if there are any other kind of well-studied interventions, either at the community level or above that you feel would be important to kind of message out to this group.
I think that when we're talking about, we've moved from kind of the suicide, unintentional injury category into what I would call youth violence, or sometimes community violence is used. And I think that policies that are actually happening across the country right now are funding community-based efforts to prevent violence. And those include things that Ruth and I are involved with in hospital-based programming, hospital-based violence intervention programs, which have a good amount of evidence for them, and they need more. So we're also looking towards doing more research in those. And I think, as Representative Stephen mentioned, and Kelly was mentioning, we need to partner these community efforts with evaluation so that we continuously understand what they do and what the unintended consequences are and what the hopefully goals are. So as a pediatric research institution of CHOP, I mean, we are both doing programming and evaluating that programming, and I think that that kind of cycle of do it, evaluate it, make it better, is really something that has not gotten enough funding or policies to promote. So we certainly want that to be part of the equation. Just a good idea isn't always a good idea, right? And so everybody has good ideas. I have some of them, and some of mine weren't. So I like proving it one way or the other.
Yeah, I mean, I completely agree.
Oh, Ruth, you can add something if you'd like.
Yeah, I was just going to say, I think, so I definitely agree. And I also think that this is an opportunity to talk a little bit about kind of taking a step back and talking about the effectiveness of policy. And I've seen some questions in the chat that also address that. I think that there's sometimes just a little bit of doubt about whether or not policies are really going to change the behaviors of people who are engaging in illegal activity with guns, and whether or not the policies are really just going to kind of inconvenience or inhibit the Second Amendment rights of people who own guns. And I do think that that's kind of a misconception, the idea that policies are ineffective. I think that there are entire bodies, Kelly can definitely speak to this as much as any of us, there are entire kind of academic institutions that have departments that focus on measuring the effectiveness of policy and whether or not they affect the loss of lives and the numbers of injuries that we see due to guns. And they parse it down. They look at whether or not it affects homicides or unintentional injuries or suicides, et cetera. And so I think that one of the things I often encounter is this defeatist perspective that you're not going to change anything by changing a law. And I really do think that that's a misconception that needs to be addressed. And we could definitely do a better job of demonstrating, talking to people about how a policy could completely protect someone's continued ability to own a gun legally without and continue to save lives. And that evidence exists. It's fairly robust, and yet it's something that I think gets lost in the conversation when we really start to get into community. So I definitely think that that's a common misconception that needs to be addressed.
Thank you, and thank you for just pointing out the importance of that cycle of trialing something and evaluating it and only keeping the things that actually do have appropriate effect without the unintentional consequences. I'm going to just ask one more question, and then unfortunately I think we have to wrap up. And this question comes from the audience. It goes, how do healthcare organizations who try to maintain neutrality on a hot topic such as this support the community with efforts to decrease gun violence and engage with community programs? And Joel, given your expertise, I'm going to ask you to start us off here.
Right. Well, thank you for that question. We're all really passionate about this issue, and it gets, anyone who reads about these issues or sees them on television gets directly impacted by it. And those of us who are in the trauma room, as Ruth said, can't stop thinking about it sometimes. So the question then is, how do you convert that passion into operationalizing what we know works and without necessarily being biased, right? And I don't think you can, honestly. I think that you can try as best you can to take what is known, again, what is known to work and try to use implementation science and other ways of approaching it so that you can make it work in a community. But the community has to be part of that picture from the beginning. And we talk about community-based participatory research, but just community action is as important. So, and the community is different, as Representative Stevens mentioned. It is incredibly diverse. And so teachers are a community, pediatricians are a community, and neighbors are communities. So understanding who the stakeholders are and making sure we listen first and a lot before we think we can implement something that is going to work in their world. I think that's where impartiality comes in, because if you don't listen, then you're just going to plop something down that, again, you think may work and it'd probably fail.
I agree with Joel. I don't think many of us are neutral. on this topic. I think we have strong feelings about what it means and what the implications are of these policies for the children that we serve. And I think that that's an asset, not a liability.
Thank you so much. And I'm just going to ask if anyone else has anything else they'd like to mention just as a final remark before I turn it back to Rebecca.
Yeah, I just want to say something. You know, I think that it's really important, the work that you all are doing, because as Joel said earlier, clearly this is a lane that you need to be working within. And I'm glad to see that healthcare providers are stepping up and engaging in this policy discussion and trying to advance, again, evidence-based practices to help save these lives and prevent, you from seeing these folks in your ERs. So thanks for really working in this space and bringing a thoughtful dialogue to the forefront here on these important issues. I really appreciate it, and I think it's meaningful and will really help change policies here in Pennsylvania.
Thank you, Rep. Stevens. I think that's a really important note to end on. So thank you to everyone who has joined us today, and especially to our panel of experts for this, terrific conversation. We do hope it can help inform efforts to support evidence-based policy decisions and drive research to fill in evidence gaps to protect children from the dangers of firearms. I do want to give a special thank you to Laura Cavello at Policy Lab, who really did the work to put this together. And so there's a lot of work behind the scenes. And to everyone who for the questions in the chat. And again, this event, a recording of this event will be posted on our website tomorrow. So if you want to go back to it, and that is policylab.chop.edu. So thank you, everyone, and have a great afternoon.